Okay, so this is my capstone project for honors mentorship, and I did my mentorship in the ER at Northeast Georgia, and at the Gainesville one, of course, because I'm not driving to Brazelton. But my main mentor was Jessica Melendez, and she's a patient care technician or just a tech, and I wasn't always with her. I will go multiple months without seeing her. So a few of the other ones that I'm usually with is Kyle and Edgar, but I've been with around, I say, 20 other techs and paramedics throughout my few months. So that's just some background. And part of the capstone, you have to put together a presentation, of course, but that's not where we started. So go ahead. And the skills I developed while I was in ER was social skills, because I had to interact with patients and I'm not really social. I'm kind of stick to myself, so that was a skill I had to learn. And patient care, because I took vital signs and I did a lot of things. I would take IVs out. I would clean wounds. I would assist with stitches and assist with taking them out and staples and all that good stuff. And then organization, this would have to do with charting. You would have to know how to be organized, and also with because techs have to stock their areas. So I would help with stocking, and you just needed to keep everything where it always was, so nurses and doctors could be able to find it. And I learned leadership.
Ms. Evans, do you have Joseph Carrillo?
Yes.
Did you send him the counselor's office?
Yes, ma'am.
Thank you.
And I learned leadership through having to kind of go off on my own sometimes and take charge. And then motivation, that just kind of goes along with actually having to do a real job. Sometimes you're not motivated, and it's just a lot, so sometimes you just get tired. And then compassion, for that kind of goes along with the social skills, because how to interact with patients. You don't want to be mean to them because they're having a hard time. Because the one thing I learned was you don't ask them if they're having a good day, because they're all going to tell you no, and they're not going to say it very quickly. And they might add a few cuss words to that I have. But, okay, next. So, like I was saying, capstone project, the first component was coming up with an essential question and a goal, and I'll discuss my essential question and goal. But basically, towards the end of last semester, around December, we had to come up with a goal just through everything we saw in our mentorship and through our annotated bibliographies. And we did one annotated bibliography just to kind of figure out what we wanted to do. And then after that, once we kind of dipped our feet in the pond, I guess, we decided what we wanted to do our research on. And I decided around the second annotated bibliography, and then the third thing you have to do for a capstone project is research. And your research, it includes annotated bibliographies, but it also includes interviews. And I had I interviewed some of the techs, and I just basically asked them questions that would go alongside my research, and just some easy stuff, but stuff that would benefit me. And then the last thing was presentation, which this is a presentation, and a website, which we're having to come up with a website to present at the end of this month, and it'll just have all the stuff we've done throughout this school year on it. So my essential question is, how do I evaluate and decide how to deal with a patient and their needs in the emergency room? And I basically got this, it started out as when a patient would come in, and they would come into triage, which is the waiting room area, and we would take them back to their rooms. I kind of wanted to know how to deal with a patient, and what do I need to go get for them based on their symptoms and diagnosis without the tech telling me, because usually they would have to tell me what to go get, and I didn't want that. I wanted to go off on my own, kind of. So that's where that came from. And then that kind of changed once I started doing my research, and here's all my whys for choosing my essential question. So, like I was saying, I just kind of want to go off on my own, but also we have a lot of behavioral health patients come in, and that's like mental patients. And I saw this, and I kind of wanted to contribute that into my essential question. So that's why my essential question can be, it's not to one specific thing. It can be taken to different, symptoms and diagnoses. And that's why I chose this. I just wanted to see if I could figure out in my research a why for behavioral patients coming into the ER. Because, we have a lot. When I started back in September, we probably had about 4 a day, and right now we're maxing out about 20 behavioral patients a day. And it's just that increase made me think. And then my first annotated bibliography, like I was talking about earlier, it was talking about nurses in the ER having to switch from curative care, which is like trying to heal the patient, to end-of-life care. That really just got me thinking about all the different types of cares you could provide and needs that the patients had. And that just kind of fell, and I just want to find a connection, I guess is what I'm trying to say. Okay, next one. And then this was a summary of my annotated bibliography, the first one, and it was called Emergency Room Nurses Transitioning from Curative Care to Find End-of-Life Care in the Rural Influence. This is basically, that part was a study, which I didn't really focus on the study. I just focused on the first 10 pages of the article, because there was about 30 pages. But I really liked this article because it just got me thinking about you don't want to heal patient just physically, you want to heal them mentally too. And I really liked that. And it also talked about how you wanted to help heal the patient's family, and because they're a big part of it too. So this was kind of what set my research into motion. And then my next annotated bibliography was a chapter from the Advocacy Handbook. And this one was basically about mental health patients in the ER. And it just talked about how they were trying to seek help for different things. This one, I think, about this article was about substance abuse. And if they didn't get the help they needed, that they would try to seek it in emergency departments, and they wouldn't quite get the treatment they wanted or needed because they're so busy in the emergency departments, and they would go out and end up in jail. And that's just what I talked about, was how the factors, because some of them won't come in because they're scared, or they don't want medication because they're trying to get off of a substance. And I just liked this because it really helped me get the factors into what a mental patient would think. Okay. And then my third and last annotated bibliography was about inmates. And I did this one because we have a lot of inmates, and you would think they would be, we in the ER would have the same procedures for them as we do the behavioral health, and we kind of do, but it's a little different. So, and I don't really deal a lot with inmates, so I just did my own little research, and this one just basically talked about a certain inmate and how she didn't quite get the privacy or respect that she wanted, and I thought that's really important. So I was just going to contribute that to my essential question, and about how I could learn how to provide treatment and deal with inmates, because I really didn't get that. Okay, and then the next slide, I'm pretty sure. Okay, my visuals. I have visuals. I just want to talk a little more too. We're talking with brochure. So for the brochure, I made a brochure. It's kind of crinkly because I glued it together. Oh well. And I made a guide, and it's called The Process of Behavioral Health Patients in the ER, because this was one of the main factors I would say in my essential question. And I just basically, it's a step-through-step process, and it just talks about everything that they have to do and that we have to do for them just as soon as they walk into the ER. So it's up here, go and see it, but y'all don't have to. And then my Prezi, I did the 5 most common symptoms seen in the ER, and if you click that link, it should take you to it. And I did this because also, you know, not every patient is the same, and their needs are different, and there's even if they have the same symptoms, they're different. So, and I just kind of really thought about symptoms too, played into a role in my essential question. So I did the 5 most common symptoms that come into the ER at Gainesville, and this is just a list I made. So if you click, first one is shortness of breath, and this one I see about once a month probably, but it's sometimes twice a month. But a lot of people, a lot of older people would come in for shortness of breath, and we usually treat it very seriously because it's usually only older people. And I'm not sure, I haven't really got to be on a case of shortness of breath, but a lot of times you have to deal with respiratory therapists. Like I have transported a patient with shortness of breath, and the respiratory therapist had to come with us, and they were hooked up to stuff with them, and it's just, that was I think interpreting my essential question. Okay. And then the next one is trauma or injuries, and this can be a lot of things qualify as traumas, like broken bones, lacerations depending on how deep they are, motor vehicle accidents, and like stroke alerts, cardiac arrest, a lot of those things, and attempted suicide victims. We have a lot of those, and like the other day we had a lady come in, and she had overdosed on 4 kinds of drugs, and combined that with alcohol, and I know one of those was Xanax, and she took about a whole bottle of Xanax. And so she was came in. She only had about 2 respirations when she came in, and her blood pressure was 40/20. I do remember that. So, and I remember going to the trauma room and dealing with that one. But traumas are usually taken to the A area because they're right there at the trauma bay. And we have 2 trauma rooms that we usually, the severe ones, which are level 1s, will go to trauma rooms. The next one is high blood pressure, and most times doctors, patients that go see their doctors that day will come over, and their doctors will be like, call us, and they'll say, oh, this patient, blah, 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 has high blood pressure over here, so we're going to send them over to you. And most times, I'm going to tell you, we don't really do nothing because it'll be like 135/80. That's not high. But we have had a lot come in, like that's over 200 for systolic. So what you just do as a tech, you just notify the nurse, and that's basically what I do because I'm not a nurse. So I just notify the nurse, and she usually takes care of it from there. But that's a pretty common one, I would say. Altered mental status, like in the brochure. I forgot to put this in the brochure, so I just put it here. The most common age for people who come in as behavioral health is under 12 usually, and they're usually suicidal. We have started seeing like a lot of 5 and 4-year-olds come in who have tried to commit suicide, and it's very common. Usually the most behavioral health patients are kids and young teenagers. We have a few adults usually, and the adults usually are like trying to get off of a substance, or they're just depressed, or we have a few that are suicidal too. But yeah, it's really sad to think about kids, but that's why I wanted to do my research, was try to figure out why they would come in, and it's all I could find really was that they didn't get the help they needed when they sought out for help, so they came to the ER as the last result. Okay, next one, and the last one is abdominal pain. Oh my gosh, I see this one all the time. because abdominal pain could be for anything. Like, we have a lot of people come in, not even lying, they say they have abdominal pain, and they will only have like gas or be constipated. Some people come in cramps. One lady actually came in with abdominal pain the other day and found out she was pregnant. She was about 8 months pregnant. But, and then it just, like, we have a scale for abdominal pain, and basically any area of the ER you go to, you're going to find a patient with abdominal pain, because they just place them throughout the ER based on severity. But a lot of them are in the G area, and usually when they're in G area, it's for like cramps or gas. I mean, it's nothing serious. So that's the end of my presentation. And I just want to say all my research that I did will go towards my future career in nursing, so I'm excited about that. Do y'all have any questions?